Good morning, everyone. Are you good? All right, so please, let's be lively and interactive. I hate presenting to boring people, so please don't. So I'm going to talk about the upper ground forces, youth-led innovation, and peer-to-peer programs. Next slide, please. Oh, must I use this thing? Oh, let me test it first. Oh. All right, my disclosures. I bring today poor eyesight and an undetectable viral load. What do we do at Advocates for the Prevention of HIV? We ensure cutting-edge HIV science and research is translated into actions. We lead an advocacy agenda to hold policymakers accountable for delivering an AIDS response that reflects our current state of knowledge. We foster this through leadership of the APHA team, extensive knowledge of evidence-based HIV prevention technologies. We also aim to change and create informed discussion on HIV, specifically at a political and policy level. Sometimes when we do these discussions, we realize that we're not always on the same level. Who of you young people have been in a room and you felt like you know more than the nurse? By a show of hands. Or sometimes you know more than the politician? By a show of hands, right? And these are the people that are supposed to make policy for you. Also at the community level, and most importantly at provincial and national levels. Our aim is basically for government and civil societies are committed to policy research and investment rollout of combination HIV prevention, all people empowered and able to access HIV services and new infections decreasing at a rate which will enable us to ending AIDS as a major health threat by 2030. By the way, 2030 is 4 years from now. How we work with ground forces, forces on the ground, community champions. The upper team could not be everywhere, so we are a very small team, and we realized we could not be everywhere, and we need to work with the people on the ground, and also requests for upper to mentor young people. A lot of young people asked us to mentor them. We work with AIDS Council, national, provincial, and district levels. Very important that whatever we do is not just at a provincial level. And I heard a lot throughout this conference about people saying, let's go to the people who are in the villages or in far rich places. So we actually work with those young people and also at district levels. We also engage with the following sectors: the men's sector, women's sector, research sector, and the LGBTQI sector. We have technical working groups that we influence, and we are very specific about reaching those technical working groups. The prevention technical working group that was set up to monitor HIV prevention, but also give guidance. And we have young people who sit on this, and we also we're part of the Ring Implementation Technical Working Group in South Africa. And our organization and young people were very instrumental in ensuring that the choice agenda is implemented in the country. We also have global accountability boards that we sit on. We sit on the African Women's Prevention Community Accountability Board. Just to mention, this board is specific about mentoring young leaders and ensuring that we do have a skills transfer as well as enough information for young people to go on and lead in their communities. We are part of the Global Accountability Board for Gilead, VIV, as well as the Dual Prevention Community Advisory Boards. Our major achievements: we hosted a very successful Prevolution bootcamp with 55 participants in South Africa, and we're looking at making this regional. The word prevention revolution was actually coined at APHA. APHA received the Wakefield Outstanding Dedication Award, strong APHA representation at conferences, and that was in Lima, Peru, as well as the conferences that are happening. We actively participate in the Purpose 1 GCAG in Amsterdam, and our intensive GBV advocacy during 16 days of activism. Also, I don't know who put that in, but I will read it in any case. The executive director won the Manny L. Baumick Breakthrough of the Year Award for advocating for the inclusion of adolescent girls and young women and pregnant and breastfeeding women in the trial for lenacapavir. I think that deserves. So who are the ground forces? They are forces on the ground. They are a network of young people spread across all provinces in South Africa, committed to achieving an HIV-free generation. They collaborate with libraries, churches, radio stations, sports grounds, NGOs, and community organizations, national and provincial, local and district councils, as well as engaging with government. Sometimes when we work with young people, we think there has to be a lot of resources available, but I say shine bright in the corner where you are. We're going to sing that song just now, don't worry. We are young people on a mission to prevent new HIV infections, and these young people are really, really dedicated with the work that they're doing. They ensure that young people that they come in contact with really understand what HIV prevention, leadership means and look like. We also do acknowledge the work of young people. So at APHA, at an annual basis, we do awards for young people who have done amazing. Young people would like to be seen and recognized. I think Jerome couldn't have said that enough during her presentation. They advocate for biomedical technologies to become a reality. When we started those programs, all of that was just a dream, not really knowing what they're going to look like, but just ideas of what they look like. PrEP in South Africa advocated for by APHA. The ring advocacy, no questions about that. APHA really ensured, and our ground forces ensured, that our communities know what it is about. And currently, the 2 injectable biomedical interventions, CAB and lenacapavir. So I don't want to skip this very important moment, because just before the global funding cuts, our young people would have monthly outreach across the provinces, partnerships with stakeholders and resources provided, including food, stipends, and learning materials, and sanitary towels. I mention that because sometimes when young people do their work with their peers, young people just don't want to just hear about HIV prevention. So we teach our young people to be resourceful, to have campaigns for raising funds to get sanitary towels, etc., and learning materials. I mean, we have Lerato. She walks around with a backpack, and you would think it's books. When she opens it at any given point in time, she should be able to help a young person with sanitary towels, with condoms, whatever they need. After the funding cuts, our program risked shutting down, and I say risked because we refused to shut down. When I called the young people and told them our funds were 96% cut, they said the funds are cut, the funds are gone, but we are still in our communities, and I think we should give them a round of applause. Also, young people lost vital support. So because they could not reach their communities as they did previously, a lot of young people lost vital support from our ground forces. The challenges, obviously, is the rising HIV infection amongst young people. We don't want to see any young person infected with HIV, and I say, we need to say, not on our watch. Limited funding, amidst the stop work orders, the big word that we all hate and should, diminish focus on community engagement. So very little community engagement is currently happening, and urgent need for innovative solutions. Our response to that was adapting and innovating. We used our social media platforms as our primary advocacy tool, sustained our mission with government funding, and also continued promoting HIV prevention and sexual and reproductive health awareness. The social media strategy, each member reaches a unique audience, yet they are united by one goal of HIV-free generation. Platforms that they use is Instagram, Twitter, Facebook, TikTok, local radio stations, and local newspapers. Content in the form of posters, educational campaigns, live sessions addressing stigma and solutions, polls, and Q&A. The key topics that they cover is HIV awareness, sexual and reproductive health education, reducing stigma, choice agenda promotion, and our strategy ensures engagement, awareness, and practical solutions for young people across South Africa. Important impact and achievement successfully transitioned from in-person to digital, maintain consistent community presence through online platforms, continue to educate, inform, and empower young people despite the funding limitations, and also reach audiences who otherwise would have missed critical information and support. Lessons learned is innovation thrives under constraints, challenges, inspire, and creative solutions. Collaboration matters. Leveraging local partnerships amplifies impact. Our digital platforms are powerful for advocacy and education. Youth leadership drives change. We continually prove our resilience and our commitment. And I highlighted that, don't waste a crisis. We are in a crisis, don't waste it. Obviously, next step is for APHA ground forces to continue the online and social media advocacy, explore new collaborations with local stakeholders, expand and engagement through interactive live session, and keep driving towards an HIV South Africa. Our call to action: together we can make a difference. Support youth-led initiatives in HIV prevention, engage with our campaigns online and offline, spread awareness, reduce stigma, and promote sexual health. HIV-free generation, HIV youth leadership, and #APHA. An HIV-free generation is possible, led by young people.